In this video, we are discussing the new Center of Medicare and Medicaid Service initiatives for patient-centered medical homes. This video is focused on the Chronic Care Management Service. It represents new revenue to primary care providers, but the challenge is the requirement to support care collaborative models. In this model, chronic care documents need to be available 24/7 by other care providers. Additionally, we would need to discuss about a closed-loop system with feedback from other care providers back to the primary care provider. What would be a care collaborative model? Let's walk through the typical scenario. A patient registers for chronic care services with a primary care provider. A chronic care document is created and stored in the electronic health record system. This system is supporting the primary care provider's clinic or hospital. As of today, the EHR is only accessible by the primary care provider. Now, the patient visits another specialist. The specialist requires for chronic care document access. The specialist cannot directly access the primary care provider's EHR. Today's access is supported via legacy methods such as a call center. It is simply a high-cost, low-efficiency approach. On the other hand, the specialist has no means to provide feedback to the original primary care provider. It is up to the patient to inform the primary care provider about the newly developed medical condition. Without this capability, the whole care collaborative model falls apart. The challenge for primary care providers to adopt chronic care management service is on its business model. While CMS reimbursement represents new revenue, primary care providers have concerns on the required upfront investments on legacy methods, health IT infrastructure, and potential disruption of existing primary care providers' workflow. It potentially turns new revenue into net loss to primary care providers' operation. Let us introduce you to the innovative concept of health collaborative ecosystem. First, it is a true patient-centered collaborative model focusing on the patient with primary care providers as the care coordinator. Second, it is about the bidirectional medical information flow, enabling the collaborative model. Last, it is referred to as an ecosystem as the complete package of health IT solutions with services to minimize primary care providers' workflow impact. The outcome for health collaborative ecosystems is to turn new revenue to net new revenue and to remove upfront risk for primary care providers for wider adoption. The final goal is to improve patient outcomes while curbing the overall healthcare cost. Let's now go back to the financial challenge for primary care providers. Same new revenue, but no upfront investment in efficient health IT significantly reduces the overall cost for primary care providers. Furthermore, revenue sharing approaches guarantee primary care providers to get net new revenue. To sum it up, it is about net new revenue with no upfront risk to the primary care provider. Zoeticx ProVizion CCM is our solution for supporting healthcare collaborative ecosystems, ensuring the guaranteed outcome for primary care providers. The solution improves patient care outcomes for chronic care conditions. The solution also provides a solid base for integration between physical and behavioral health services. A primary care provider with 1,000 patients eligible for chronic care service represents an additional annual $500,000. This revenue can be generated without any upfront investments on health IT solutions or hardware cost. It also leverages the existing deployed EHR system. Zoeticx ProVizion is cloud deployed, connecting to EHR systems with a web user interface.